Hello, beautiful people. It's Steffi B, and I'm here to study with you guys today. And today's topic is going to be the cardiovascular system. And we're going to go ahead, we're going to get started, and we're going to do 10 questions. All right, let's go. Question number 1. A client admitted to the hospital with chest pain and a history of type 2 diabetes mellitus is scheduled for cardiac catheterization. Which medication would need to be withheld for 24 hours before the procedure and 48 hours after the procedure? 1. Glipizide, 2. Metformin, 3. Repaglinide, or 4. Regular insulin. And if you guys need more time, just hit the pause button. And the answer here is number 2, metformin. So why is that the answer? Let's go to the question. What are they asking us? They're asking us, what medication would we hold before a cardiac cath 24 hours before the procedure and then 48 hours after the procedure? So just remember, you always want to hold metformin. Okay, so that is the one medication you want to hold. All the other options are okay. And that is because they are at a higher risk of developing lactic acidosis, right? If they have contrast medium in their system and they have metformin, that is not a good combination. We do not want that. So you want to take a look at their medical history, their medications, see if they're given metformin. If they are given metformin, you want to hold it. Number 2, a client is wearing a continuous cardiac monitor, which begins to sound its alarm. The nurse sees no electrocardiographic complexes on the screen. Which is the priority nursing action? 1, call a code. 2, call the healthcare provider. 3, check the client's status and lead placement. Or 4, press the recorder button on the cardiogram console. And the answer here is number 3, check the client's status and lead placement. Okay, so why is that the answer? Let's go to the question and see what they're asking us. They're asking us, what is the priority nursing action? So we're looking for an intervention, right? An action that we want to do as a nurse. And they're telling us in the question that there is a client and the client is wearing a continuous cardiac monitor. And it starts to alarm, right? And they don't see any electrocardiograph complexes on the screen. So what does that mean? What do we do as a nurse? Okay, so there's 2 reasons why we would see no electrocardiographic complexes on the screen. So the first one can indicate a ventricular asystole or also a lead displacement, right? So like the leads are falling off the patient, right? So that's why it's probably not showing up on the screen. So usually the rule of thumb is we always want to assess the patient, right? And then the machine, right? So here, what we want to do is we want to make sure that it's connected to the patient, right? So the first thing we want to do as a nurse is assess, right? Before we call a code or call the healthcare provider, we want to see what we can do as a nurse. And as a nurse, priority action would be number 3. Check the client's status and lead placement. Number 3, the nurse is monitoring a client with acute pericarditis for signs of cardiac tamponade. Which assessment finding indicates the presence of this complication? 1, flat neck veins. 2, pulse rate of 60 beats per minute. 3, muffled or distant heart sounds. Or 4, wheezing on auscultation of the lungs. And the answer here is number 3, muffled or distant heart sounds. Why is that the answer? Let's go to the question. So the question is asking us to identify cardiac tamponade. So what does that complication look like? So that is exactly what we need to look for in the answer. So if we look at the options, so number 1, flat neck veins. So for a client that has cardiac tamponade, they would have jugular vein distension. Okay, so number 2, a pulse rate of 60 beats per minute. Somebody that has cardiac tamponade would have tachycardia, so their heart rate would be elevated. They would have muffled and distant heart sounds. And then number 4, wheezing on auscultation of the lungs. No, their lungs would be clear. Okay, so this has everything to do with the cardiac, with the heart, with the circulatory system, not the lungs. So you would hear clear lung sounds, muffled and distant heart sounds, tachycardia, increased heart rate, and jugular vein distension. Number 4, the home care nurse is providing instructions to a client with an arterial ischemic leg ulcer about home care management and self-care management. Which statement, if made by the client, indicates a need for further instruction? 1, I need to be sure not to go barefoot around the house. 2, if I cut my toenails, I need to be sure that I cut them straight across. 3, it is all right to apply lanolin to my feet, but I shouldn't place it between my toes. Or 4, I need to be sure that I elevate my leg above the level of my heart for at least an hour every day. So here the answer is number 4. I need to be sure that I elevate my leg above the level of my heart for at least an hour every day. So that statement is incorrect, right? So in this question, we're looking for a statement that's incorrect, that needs further teaching, right? So it shows that they don't understand the care that they need. So this patient has arterial ischemic leg ulcer, right? So this patient technically has peripheral arterial disease. So their foot care instructions are going to be very similar to a diabetic's. If we look at the options, number 1 is correct because we do not want them to walk around the house barefoot. Number 2, we want them to cut their toenails straight across, right? So that's correct too. Number 3, we do want them to apply lanolin on their feet, but not between their toes. We don't want bacteria or fungus to grow between them, right? So all those options are correct. The one that's incorrect is number 4. We don't want them to elevate their leg above the level of their heart. Why? Because they have peripheral arterial disease, right? What does that mean? So let's think of the veins and the arteries. What do the veins do? What do the arteries do? So the veins bring the blood back to the heart, and then the arteries, bring the blood away from the heart, right? So somebody who has peripheral arterial disease has trouble trying to push the blood away from the heart, right? So we want to keep their feet down. We don't want to elevate it. We only would want to elevate it if they have venous stasis. So if they have pooling of blood in their feet, if there's swelling in their feet, then we would want to elevate them to help bring the blood from their feet back to the heart, right? So here the incorrect answer would be number 4. Number 5, the nurse is providing instructions to a client with a diagnosis of hypertension regarding high sodium items to be avoided. The nurse instructs the client to avoid consuming which item? 1, bananas, 2, broccoli, 3, antacids, or 4, cantaloupe. Here the answer is number 3, antacids. So why is that the right answer? Let's look at the question. Let's see what we're being asked. So they're asking us, what food should a client avoid for a client that has hypertension? So a client that has hypertension wants to avoid food that has high sodium, right? If we look at the options, food like bananas, broccoli, and cantaloupe have the least amount of sodium. Fruits and vegetables have low sodium. Here in this option, antacids would have the most amount of sodium. Also, too, other products like toothpaste and mouthwash have a high amount of sodium, right? Also, too, over-the-counter medications, so analgesics, antacids, laxatives, right? Softened water and mineral water. Those are products and things that we have to keep in mind for our exam that have the most sodium. Denver, say hi over here. Say hi. Bark this way. Denver, bark. Number 6. The nurse in the medical unit is reviewing the lab test results for a client who has been transferred from the ICU. The nurse notes that the cardiac troponin T was performed while the client was in the ICU? The nurse determines that the test was performed to assist in diagnosing which condition? 1, heart failure, 2, AFib, 3, an MI, or 4, ventricular tachycardia. The answer here is number 3, an MI. Why is that the right answer? Let's go to the question. Let's see what we're given. Let's see what we're being asked. So in this question, we're looking to see what the lab troponin T means, right? So if a client is getting a troponin T lab, what are they diagnosing? What condition is it? Guys, just remember, troponin T, troponin I, so those labs are for an MI, right? So troponin is not supposed to be in your bloodstream, and that's what we're testing. If somebody has an MI, a heart attack, their heart is going to be damaged, right? When somebody's heart is damaged, their troponin, which is in their heart, will go into their bloodstream. So we test for troponin in their bloodstream. So here, this question is asking, what condition is it for troponin? The answer is number 3, MI. Don't forget. Number 7. The nurse is performing an assessment on a client with a diagnosis of left-sided heart failure. Which assessment component would elicit specific information regarding the client's left-sided heart function? 1, listening to lung sounds. 2, palpating for organ omegaly. 3, assessing for jugular vein distension. Or 4, assessing for peripheral and sacral edema. And the answer here is number 1, listening to the lung sounds. So why is that the right answer? Let's go to the question. What are they asking us? They're asking us which assessment component would go with left-sided heart failure. So guys, just think of it like this. So L for left side, L for lungs, right? So if somebody has left-sided heart failure, think of lungs, so you would want to assess their lung sounds, right? Because the left side of the heart, usually if it's functioning correctly, it would push the blood to the rest of our body, right? If it's failing, the blood is gonna backflow into the lungs, right? So we might hear crackles, right? So we want to listen to those lungs. The right side, you would see number 2, number 3, and number 4, right? So it has everything to do with everything else besides the lungs, because the blood flow would go backwards if it's failing, so it would go back to the body, right? So here the answer is number 1. So left-sided heart failure, you want to listen to the lungs. Number 8. The nurse is caring for a client with a diagnosis of MI and is assisting the client in completing the diet menu. Which beverage should the nurse instruct the client to select from the menu? 1, tea, 2, cola, 3, coffee, or 4, raspberry juice? And the answer here is number 4, raspberry juice. So let's look at the question. In the question, they're asking us, what beverage should we give a client that has an MI? If we look at the options, 1, 2, and 3 all have caffeine in it. So for a client that has an MI, we want to avoid caffeine. So that makes number 4 the right answer, raspberry juice. So why do we want to avoid caffeine? We want to avoid caffeine because caffeine can produce vasoconstriction, right? And we do not want that to cause cardiac ischemia, right? We want that blood to flow, right? We want those vessels to be dilated. We don't want it to vasoconstrict, right? So here the answer is number 4. Number 9. A client with no history of heart disease has experienced acute myocardial infarction and has been given thrombolytic therapy with tissue plasminogen activator. What assessment finding should the nurse identify as an indicator that the client is experiencing complications of this therapy? 1, tarry stools, 2, nausea and vomiting, 3, orange colored urine, or 4, decreased urine output? So here the answer is number 1, tarry stools. Okay, so why is that the answer? Let's go to the question, let's see what they're asking us, and let's see what we're looking for. So in this question, they're asking us, what assessment finding will we look for thrombolytic therapy? So this client had an acute MI, which is a blood clot in your heart, and they're on thrombolytic therapy, which is a clot buster, right? It'll go up in there and it'll break up a clot, right? And it'll also prevent future clots to form. So a complication would be bleeding. So if we look at the options, we're looking for an option that shows bleeding. So here the only option would be 1, tarry stools. And that is because tarry stools shows bleeding in the gastrointestinal tract, right? So if blood is digested, it'll turn a black color, right? So if you have bleeding in your esophagus and your stomach, right? Or your upper tract, and it's digested, it'll turn a dark tarry color, right? Also called melena. All right, so here the answer is number 1. Number 10, the nurse notes that a client's cardiac rhythm shows absent P waves, no PR interval, and an irregular rhythm. How should the nurse interpret this rhythm? 1, bradycardia, 2, tachycardia, 3, AFib, or 4, normal sinus rhythm? Here the answer is number 3, AFib. So why is that the answer? Let's go to the question. So the question is asking us to interpret a rhythm. The information they gave us is there's no P wave, there's no PR interval, and it's irregular. So what is that describing? Bradycardia would be a slow heart rate. Tachycardia would be a fast heart rate. But there's a specific rhythm that we need to keep in mind that has no P wave and no PR interval, that's irregular. Number 4, normal sinus rhythm is incorrect because P waves are present before every QRS, PR intervals are present, and it's regular. So the only one that does not have P waves, no PR interval, that's irregular, is AFib. But the problem is in the atrium, right? It's not fully contracting or fully filling, right? It's just quivering, it's shaking, it's doing its thing, right? And the problem with AFib is since it's not fully contracting and filling, blood tends to pool in that area, which they're at a higher risk for clots. But here, what we want to know is what this rhythm is. So if you have a rhythm, no P waves, no PR interval, that's irregular, think of AFib. Number 3. Guys, we are all done with the 10 questions on the cardiovascular system. Thank you for being here. Thank you for studying with me. Guys, keep going. It's worth it, okay? If you want to like the video, go ahead, like it. If you want to leave a comment, you can do that too. And guys, keep going, stay focused, do your thing. All right, good luck. Bye, beautiful people.